Hello, I'm Dr. Chetan Bhatt, mentor of the Gastroentrology Department at Sir H.N. Reliance Foundation Hospital, Mumbai. We have very advanced and complete gastroenterology department at Sir H.N. Reliance Foundation Hospital with excellent team of clinicians, world-renowned motility expert and technically skilled expert endoscopist. We have all the latest advanced endoscopes, diagnostic and therapeutic, upper GI and lower GI ileocolonoscopes with the latest X1 1500 series. We have also latest ERCP Scopes 180V and 190V series. We have endroscopes, which is single balloon and latest spiral endroscope, which can evaluate the entire length of small bowel for all the diagnosis and also available therapeutic procedures. We have latest advanced solid state manometry machine with MMS laboratory version 10 software, which we can do esophageal manometry with impedance, enteroduodenal manometry, anorectal manometry. Now this manometry examination is required for the people with a difficulty in swallowing or reflux disease or burning in the chest. So people who have difficulty in passing stools, who have to strain at passing at stools, we also have this anorectal manometry. We can identify various disorders with this. Person with a difficulty in swallowing with normal endoscope, we have upper GI manometry, that is esophageal manometry, and pH metry, which can diagnose various conditions. So we also have water perfusion manometry machine, which with that we can do pH metry and we can do impedance. We can do esophageal and anorectal manometry also. Now to diagnose various fatty liver disease and grades of fatty liver and fibrosis, we have non-invasive method to diagnose grades of fatty liver and fibrosis with the latest FibroScan machines in the world, which is FibroScan Expert 630 from Endoscopes company from France with the advanced ergonomics. With this machine, we also have a splenic stiffness. This splenic stiffness can also help us to evaluate the response to the treatment for the liver disease. We also have non-invasive test to detect H. pylori infection. H. pylori infection is very common today. Now, today we have to diagnose H. pylori, we have to do stool test of the H. pylori, which is not very adequate. We can also do endoscopy and biopsy from the stomach to diagnose H. pylori. Many people are not willing for the endoscopy technique. So we have this non-invasive H. pylori detection with the Helic ABT reader urea breath test machine to diagnose H. pylori and also to evaluate the response to the treatment, so we don't have to repeat the endoscopy to see the completeness of the treatment of the H. pylori. We also have a hydrogen methane breath test machine from the Bhatt company to evaluate the small bowel bacterial overgrowth. Now the patients suffering from abdominal distension, gaseousness, bloating, who are not responding to routine line of treatment, we need to evaluate the hydrogen and methane breath test. So with this test, we can find out the small bowel bacterial overgrowth and we can eradicate the normal bacterial flora and the patient can be helped. So to complete the list of all the technology and instruments, we also have a capsule endoscopy to diagnose various small bowel diseases and GI bleeding disorders. To summarize, we have complete gastroenterology department with perfect blend of astute clinicians, expert endoscopists, manometry specialists, and latest endoscopes. All the technologies which is available today in the world in gastroenterology, we have it here. Any procedure that can be done or needs to be done in the gastroenterology, we have the technology and expert to take care of the patients. Patient once enters our gastroenterology department at Sir H.N. Reliance Foundation Hospital, he need not go outside for any test or for any treatment. We have entire treatment available for all our patients. Thank you.